Hey guys, I'm Madeline Kreisel from Searcy, Arkansas, and I'm in the second semester of the Medical Scholars in Public Health program. There are several similarities and differences between the plague and COVID-19. One of the more obvious similarities is that both diseases were highly contagious and very widespread, affecting multiple countries and continents. Another similarity is that some people who were infected with the plague remained asymptomatic for a couple of days, which is very similar to some people who were infected with the COVID-19 virus. As far as differences go, the plague was actually a bacterial infection, while COVID is a virus, and the plague is believed to have been spread by fleas who carried a certain bacteria. However, some people do believe that more mature strains of the plague could have been airborne, which is very similar to the COVID-19 virus, as it was spread through the air. So during this time, very little was known about the spread of diseases, and so very little was known about how to prevent them. The textbook mentions a few applications of epidemiology, some of which include identifying risk factors and investigating disease outbreak. Both of these applications would have been useful in discovering who was susceptible to the disease and what was actually causing it. Because people were unaware of germs, they likely didn't realize the impact that their environment had on spreading the disease. Living amongst rodents and amongst unburied bodies increased the likelihood of infection with the plague. Epidemiology would have also been useful in evaluating the effectiveness of their treatments, which often included bloodletting and boil lancing. Bloodletting proved to be fairly ineffective considering most people died regardless, but several other treatments such as medication or herbs or even increased sanitation practices could have been evaluated or combined with prior treatments to produce better health outcomes.